Good morning and welcome to COVID-19 Talk with local health authorities. Joining us from Harris County is Dr. Erica Brown. Representing the city of Houston is Dr. Janina White. Dr. David Purse is actually on vacation. Special thanks to past President Kathy Finninger, Rotary Club of Houston, for providing us with these questions. And special thanks to Morgan Ash, our producer, and David Castillo, who's actually serving as producer for today. I'm Stephen Williams, the director of the Houston Health Department. This is week 83 for COVID-19. Do you anticipate a threat level change in our area? I'm sure that question is because they've seen the numbers going up.
Yeah, so I'll take the first question. Actually, we don't anticipate a level change because even though we see the positivity rates going up, our hospital rates continue to remain low. So no, not at this time.
How are wastewater plants differing geographically? Wastewater dashboard. Tell us what you think about the current data here.
So currently for the city of Houston in our wastewater review, our number increased to 170%, but that's still nowhere near we were at the height of sort of the Delta variant. So we're seeing a very slow incremental increase, but I mean, the country is also seeing several areas that are having some pockets of incremental increase, but nowhere near the height of, again, the Delta or Omicron surge. But it's still something that we think is vital to assess and to continue to monitor. It is a supportive indicator that we think is important. And so that's just a trend we're going to continue to monitor.
How are wastewater plants differing geographically?
In a sense, there are some regions that are seeing a more exponential sort of a increased slope in their wastewater information. If you're looking at sort of what's happening in the Northeast, they're seeing sort of a significant surge. But again, they're using that information to help guide some decisions about how to give guidance on sort of how to do things around masking and helping the community understand their vaccine implementations, ensuring that people who've not been vaccinated, using that as a data point to help understand why you should get vaccinated or why you should get your booster. The CDC actually has a great link for wastewater, and it helps you look at, our region as compared to sort of the overarching region across the country. So that's a great resource to kind of see what's happening in the other part of the country. But the wastewater is really matching what we're seeing when we talk about outbreaks, particularly in the Northeast right now, what they're experiencing.
Dr. Brown, any updates regarding COVID for the county?
Yes, so just as Dr. White just mentioned, as we're seeing our positivity rates go up, we're seeing that across the county. In the last month, we've seen about a 300% increase across the county in the positivity rates. However, I do want to put that in a little bit of context. This time last year, our case rate was 27 per 100,000. This year, as of 2 days ago, our case rate was 88 per 100,000. So although we see our positivity rates going up, it's still a very small number compared to where we were last year.
Do you want to add anything about the city, Dr. White?
We are seeing the same slow increment. I think the last positivity for us was 11%. We do, though, want to give that consideration that we're doing a lot more home tests than we were previously. So again, we're nowhere where we were, but we are being mindful of just watching that trajectory. But again, because people have the ability to do home tests, and we think that's great because really the point of contact is you're getting your information real time and immediate. Just be mindful that there's a lot of opportunities where this number may have a little bit of variation, again, because of the home testing capability.
Is it time to put your mask back on indoors?
So we always encourage those people to wear masks, especially those who are immunocompromised or high risk. As we continue to see our numbers increase a little bit, we would certainly, again, encourage mask wearing. the holiday weekend is coming, and so certainly it is at people's discretion at this time, but we always encourage mask wearing.
I want to just agree with Dr. Brown on that real quick. This is a very busy weekend. We're excited for so many graduates at all different levels, right? Graduate schools and middle schools, high schools, and the like. So you're going to be around a lot of people, and you may actually not know their vaccine status. You actually may have received a vaccine. Maybe you didn't complete the series for a host of reasons, or you have an immune situation. So we're asking those unique considerations, like Dr. Brown just mentioned, of why you might want to consider wearing a mask, especially during a lot of busy activities this weekend.
Are you concerned about the holiday weekend causing a surge locally?
So again, we just talked about that a little bit. I'm not sure we're so much concerned as we are cautious is a better word. The best we can do to mitigate any risk, again, that is mask wearing, good hand hygiene, being outdoors and social distancing as much as possible. And then certainly, if you have not been vaccinated, get vaccinated. If you haven't had your boosters, get your booster. Understanding, though, that it's probably a little bit late for this weekend, as those things take 2 weeks to really have an effect on your immune system. But we certainly encourage that for any summer activities that you're going to partake in.
What's new on the treatment front? Is anything new coming online if you test positive?
So not necessarily new. I think what's been exciting is we have much better stratification on who fits in what group for treatment. And so we have sort of availability for people for whatever reason are unable to get a vaccination. There's some pre-exposure treatments. We actually have 2 oral treatments for those individuals who test positive. And so that's exciting because not everybody had access to, I'm sure you've heard of like the monoclonals, and just logistically of how to get people to get monoclonals. So there's 2 oral agents, and then we also have those monoclonals as options.
Tell us about Paxlovid rebounding.
Yes, so Paxlovid rebound has been confirmed as a real thing. In fact, the CDC put out a health advisory notice about it. It's characterized as a new positive test after a negative test after treatment with Paxlovid. There's really nothing to do with that, though, other than continue to isolate if you should have a new positive test. It's not recommended to repeat the treatment at this time. And there's still studies going on as to why this is happening, but you would treat it as if you are still positive, which is, again, isolating, certainly wearing a mask if you have to come into contact with someone. But unfortunately, we don't have too much information on it at this time, other than we know that it is a phenomenon that occurs, and we would treat it the same as if you were positive.
What matrix do you look at the most as you try to understand where we are with COVID?
You know, I think we really are looking at a tiered sort of matrix or consideration. And so while we do look at the positivity and we are monitoring wastewater, we also look at what our hospitals look like and how many people are sort of pushing into the emergency departments and how many of those individuals will require sort of hospitalizations. And then when they're hospitalized, what level of care they're receiving. I know here, as well as the city, you know, we have strong partners with our schools. And so we're monitoring to see how schools are doing, how our nurses are doing, and looking at their student rosters and missed days and things like that. So we're looking at a host of sort of metrics to kind of help guide our guidance to the community about COVID.
As immunity is waning, are we seeing people get really sick?
So for our region, we're fortunately not seeing people get really sick. However, as we know, in the Northeast, we are seeing hospitalization rates go up. So the best thing we can do is to get our boosters. That is the whole purpose of the booster. As immunity wanes, is to give the immune system a little bit of boost to fight off the COVID-19 variants. That being said, even with the increased hospitalizations, we're really not seeing too much increase in death rate, which is great. And again, it's more in the Northeast at this time. That does not mean that it won't come and can't come to our region. But for right now, our hospitalization rates in general continue to be fairly low.
A study found viral remnants can remain in the body for months following infection. How long are you still contagious?
Now we're still, I think we said earlier, the same guidance. If you are deemed positive and you're being treated, you're going to sort of isolate for that 5 days. So you're kind of still following those guidances. And we know those remnants occur, but it doesn't change our information right now about how long we're asking you to sort of isolate and, stay isolated until you've gone through your 5 days. I don't know, Dr. Brown, if you've had any additional thoughts to that.
No.
Okay.
I think you covered it.
You had to anticipate that this question was going to come up. Enlighten us about monkeypox. That scares me more than COVID.
Yeah. So in fact, it's very interesting, isn't it? So monkeypox, first of all, let's talk a little bit about what it is. It's a virus, a DNA virus that it can be transmitted by animal, humans, which is direct contact, and then also materials which contain the virus. So like fomites in bed sheets, clothing, and utensils. It is, however, hard to transmit amongst people, but obviously it's happening. Okay. The incubation period is 7 to 14 days. It starts with a prodrome, just like any other flu kind of symptom is fever, fatigue, body aches, headaches, feeling like you have a cold. And then you will notice the rash, which can be pustules, little vesicles and bumps and scabs in various places. As of May 24th, there were 8 confirmed cases of orthopox, which is the parent to monkeypox. And of those, 2 of those cases had been confirmed to be monkeypox. The others are still under investigation on whether they are truly monkeypox. That being said, one of the best things we can do is, just like anything else, is to be very mindful if we're sick to stay away from others. Okay, so if we feel like we have cold symptoms, stay away from others. If we notice that there's a rash developing, obviously see your doctor to determine what that rash is and to get tested as appropriate. Another interesting thing about it is that the rash appears to be appearing more particularly in men who have sex with other men. That does not mean that it can't be transmitted and has not been transmitted amongst others, but those most cases thus far have been coming from men who have sex with men.
Have your thoughts, opinion on the extra booster changed? The person's not here. We know where he is.
Right. So I'll
Exactly. Okay, go ahead. No, I was gonna say, we really want to say, it's individual. We know what populations we're really trying to target and ensure that they have that extra layer of protection. But it's, again, still individualized, 50 and over. But if you have discussed with your provider and you have other comorbidities, we were so grateful that this is out and available, and it wasn't structured in such a way that you couldn't have access. I think that's what the CDC was offering, that support, is that initially when we did earlier rollouts, we staggered it for a population that was sort of an LTAX, a certain age, and there were other individuals, while they weren't in long-term facilities, felt that they were at need for that vaccine. So I think they broadened it to give that ability that providers and the patient can say, do I fit this group? And so thankfully, if you're 50 and over and you think you fit that group, you had access to get the second booster early.
What are the new recommendations regarding kids and boosters?
So just recently, the CDC with the American ACIP put out guidance. And so now our young people 5 and up are eligible for their boosters. And so we're leaning forward, and we have vaccine available to that population who can now get boosted. again, that population has not necessarily done, has not had the highest percent as far as getting their full vaccine series. So we're still encouraging parents, really make sure your children are getting fully vaccinated, and then they'll be eligible 5 months after that second dose to get their booster dose.
Pfizer's vaccine for 6 months to 5-year-olds appears to be ready. The efficacy is still lower than with the higher dose adults receive. Are they actively testing a higher dose? When will the EUA be granted? Will kids under 5 be approved for vaccine before the fall and school restarting?
So you are correct that Pfizer is actively testing. We do expect that the vaccine will be ready by the fall. I do not foresee, though, that it'll be a higher dose vaccine. Obviously, the reasoning behind that depends on the immune response at a lower dose versus that of a higher dose. And it seems that the lower dose is just as effective as a higher dose. So we always err to the lower dose. So I don't foresee them increasing the dose because it appears to not show any added benefit. But I would expect to see that even before school time, frankly, that the vaccine would be available under emergency use authorization for our infants.
The White House says it might have to limit the next generation of shots to those with the highest risk because of funding. Is that accurate news? I haven't heard that, have you?
Yeah, I had not heard that. You heard that? Okay.
Yes. So again, we talked about it last time. President Biden did come out and make a statement that without sufficient federal funding and a continuation of that funding, that he would need to limit availability of the vaccine to those who are immunocompromised and our geriatric populations.
What symptoms are you seeing after each shot of the same vaccine? Do they get progressively better or worse?
We've still been hearing anecdotally the same sort of localized symptoms. Maybe from the first to the second, it may be a little bit more pronounced, but it's still that localized reaction. Some people just talk about fatigue. They have headache, tenderness at the site of injection, but those localized reactions.
I'm attending a large international event requiring vaccinations or recent tests. Since it is in Houston, what is a safe definition of fully vaccinated, or should the rules of each country be used?
Well, certainly, if they're having that event in our jurisdiction, in our country, really utilizing our language for what fully vaccinated would be, it might be a challenge to think of it differently because other countries have access to different vaccines that we aren't currently using. So to see about their series when we in fact don't use those particular vaccines here might pose a challenge. But for our guidance here, fully vaccinated is having your 2 doses. So we would, you would want to make sure that that's sort of at least the minimum. And then because it's a large gathering that you said, you have people traveling from international, this was an earlier question that was posed. Should you still think about, wearing your mask, given your own personal risks? So that's something that you might want to consider.
Okay. Because the public is tired of vaccine conversations and some still afraid to receive even one, do you predict any uptake or other illnesses typically prevented using vaccines like flu and measles?
So this is a really interesting question. We've already seen a decrease in vaccinations for our pediatric population, even prior to the pandemic, and so which sparked a few outbreaks of some things. Then when the pandemic came, because of access, we saw even less vaccination rates, but really because physicians' offices and access to vaccination, all of that was closed for some time. I think that it's still going to remain up in the air about what the numbers look like as we go forward. I think that we have a duty as local health departments to let people know how effective and safe the vaccines are for things like measles and mumps and varicella and all of those pediatric immunizations, because those are things that we typically don't see very much in our country, but can have devastating effects if we do see them. And the reason we don't see them anymore is because of our vaccination status. So I think we need to really do some education to help people understand why they're necessary, and hopefully we can gain the trust of the public back.
Is BA4 here?
Yes, so BA4 is here. There are a few cases, including in Texas. So Omicron variants BA4 and BA5 have been detected in the wastewater. The predominant strain, though, still continues to be BA2 and then the BA2.12.1.
You know, we're not going to remember that last one.
No, say it backwards 3 times.
I should have written it down. Which variants are most similar in their reaction to vaccines for both protection and side effects?
I'm not sure what they're trying to ask with that question, Stephen. Say that again. Repeat that,
Yeah.
Stephen.
Which variants are most similar in their reactions to vaccines for both protection and side effects? I guess which they're asking. Let me see, can I break it down a bit? Which you got it?
I think we're talking about severity of illness. So when we look at severity of illness, right, the Wuhan strain, the Alpha and the Delta variants were relatively similar in their severity of illness, right? But I think that also is a little bit complex because at the time, through at least some of that, we didn't have vaccines. So I'm not sure you can really make that statement other than to say those in terms of illness were a little bit more severe. The Omicron variants and the BA2 and the 2.1, 2.1 and the 4 and 5 and all the other Omicron friends are a little bit less severe in illness, but they spread a little bit easier. So I think that's what we were trying to get at.
Which means that those would probably have very similar reactions to vaccines.
Correct.
Please verify and explain the statement, recombinant protein vaccines stands up to COVID. That's a quote. Recombinant protein vaccine stands up to COVID.
So they're asking recombinant vaccines stand up to COVID, but that's a type of vaccine structure. So if they're asking, are scientists looking at recombinant vaccines? They are. One consideration is they're looking at them because, you know, what I've read about that is that the cost to develop that type of vaccine strategy is less than our current vaccine cost for strategy. And some countries right now still don't have access to vaccines. So using a recombinant is a strategy to help maybe deliver additional vaccines to those communities that really have, right now, are still having trouble getting access.
Are those vaccines just as effective?
So those studies are occurring, and so that's the argument of the equity and the strategy, is that they are suggesting that they're effective. They often have different considerations. They're looking at it just being a one dose. And so if you have communities that are very difficult to really entrench and get those vaccines to those individuals, then this is another option. So there are ongoing studies about this.
I'm flying next week, so hopefully this doesn't happen to me. Allegedly, a flight attendant on one airline encouraged people to take off those masks so that we can see you smile. When would you endorse eliminating masks on a plane?
I have 2 words. I would not. Well, 3. I wouldn't. That's it.
And we keep referencing the, that personal consideration. And so what's so challenging is, if you're looking at, I think I said it before too, our travel in this country is so international and global. You don't know who really is next to you and what flight they connected to or where they're coming from across the globe. So, your personal risk stratification may be different if you find yourself at a certain threshold about your own personal risk. And so to what Dr. Brown just said, I would still have my mask, given that we know there's upticks in certain parts of in our country, right? And we also know that other areas of the country of the world are still having sort of outbreaks. So I would still continue to wear my mask.
What is COVID killing mouthwash?
So there are some studies that have shown that an over-the-counter mouthwash can kill viruses. However, there haven't been any large-scale clinical trials, so I really would not take this as a treatment plan at this time.
And I wonder too, Dr. Brown, you think about mouthwash, and so there's a consideration that they think of it as antiseptic. But we're not using antiseptic terminology in this vaccine virus conversation. So sort of two different considerations about why someone may say, well, what about mouthwash? It has these properties, but often that's about antiseptic.
Yes.
Please update the protocol on delaying mammograms after having a COVID shot.
So same consideration that we talked about earlier. This has been such a moving needle, and early in the pandemic, there were comments about or information about having adenopathy. And so, radiologists and individuals in that arena had some caution with regards to how long you should wait. But what we realize now too is what we didn't want to see happen is patients prolonging getting a mammogram who needed to have a mammogram done on their routine schedule. So really right now, if you can wait 4 weeks because it's scheduled that way, absolutely wait about 4 weeks just to ensure that that adenopathy doesn't sort of compromise or conflict with what the reading might look like. But if you have a reason for more urgency, please speak to your radiologist because they may in fact say, no, come in and let's do that study. And then we'll take into effect that you've had your vaccination.
Regular seasonal viruses are back now that we have let our safeguards down. It is said we must wake up our immune system. What will that do?
So I'm not quite sure what that means in terms of waking up our immune system. Certainly, we encourage vaccination, we encourage boosters, and then just our regular supplements, which we know can help to boost our immune system, our vitamin C's, our vitamin E's, exercise, drink plenty of water, get plenty of rest, and just take care of your body.
Sounds like the usual advice. Thank you for joining.
Yeah.
Thank you for joining us for COVID-19 Talk with local health authorities. Joining me was Dr. Janina White, representing the city of Houston, Dr. Erica Brown, representing Harris County. Special thanks to past president of Rotary Club of Houston, Kathy Finninger, for providing our questions, and our co-producers, Morgan Ash and David Castillo. I'm Stephen Williams, Director of the Houston Health Department. See you next time.